Hi, this is Mike Toso. I'm a program officer with Johns Hopkins Center for Communication Programs. On behalf of our Breakthrough Action Project, I'd like to welcome everyone to the fifth in our series of social and behavior change evidence discussions. The discussion guide you received beforehand contains a number of questions that will be addressed throughout this and every evidence discussion. The goals of these evidence discussions are to support malaria SBC practitioners who are interested in learning from emerging research. These discussions are deliberately structured to be accessible to every level of comfort with research, methods, and terminology. Malaria SBC practitioners should be able to comfortably read, interpret, report on, and apply the findings in peer-reviewed literature. Our goal is to help with that. We hope that by dissecting malaria SBC publications together, the lessons learned and the discussion that follows will help practitioners envision pragmatic, rigorously designed activities. I'd like to introduce Shelby Cash. Shelby is based at CDC Atlanta and is the Malaria Technical Advisor and co-lead for the SBC team for the President's Malaria Initiative. She is a certified health education specialist and has a Master of Public Health degree in behavioral science and health education and experience in public health research, evaluation, and behavior change interventions with vulnerable populations. Welcome, Shelby.
Thank you, Mike. Good morning, good afternoon, and good evening, everyone. The U.S. President's Malaria Initiative is supporting this activity, and I wanted to say a few words about how this fits into our global strategy to support high-quality social and behavior change. PMI prioritizes activities that improve countries' capacity to collect and use information, and while this often means country-level data, it should, in a sense, also mean taking data and lessons learned in other countries and using it to inform our own country. We are also very interested in building the capacity and health systems of countries we work with. From our perspective, regular discussion about rigorous malaria SBC evidence really builds and maintains capacity among the malaria community. And so we hope this evidence discussion series meets your needs.
Thanks, Shelby. Next slide, please. This discussion will be recorded. You'll receive a link to the recording and the slides in an email following our discussion. While everyone will be on mute during the presentation, please enter any questions you have into the chat box. We will address your questions in the discussion that follows Dr. Koenker's presentation. Please do stick around for a few seconds to take 3 or 4 post-webinar survey questions. We'd love to hear your feedback. For those of you following along in the discussion guide, the blue transition slides with titles will indicate which section addresses specific questions in that guide. A word about the structure of these discussions. In each discussion, we pull an article from the Malaria SBC evidence database. This database includes both peer-reviewed articles and gray literature. Please take time to explore it when you have the chance. In addition to learning about Dr. Koenker's intervention, we hope today's discussion sheds light on tips for reading and interpreting malaria SBC research in your own work. I'd like to introduce our presenter, Dr. Koenker. Dr. Hannah Koenker is the Technical Director of Tropical Health and was the Project Director for PMI VectorWorks, which ended last year. Her research has focused on insecticide-treated net access and use, durability, net care and repair, and distribution of nets through a variety of channels. Welcome, Dr. Koenker. Before we dive into our research today, we'd like to frame our discussion around the Socioecological Model, which we find helpful in thinking about who and what influences important decision-making about behaviors. The evidence base we just mentioned describes a growing body of research that indicates behavior isn't simply the result of exchanging information with an individual. People make decisions based on a number of individual social and structural influences. A recurring theme in our evidence discussion series is a focus on interventions designed to influence multiple audiences and structures within this model. When we say that the socio-ecological model influences our work, we're simply acknowledging that working at individual, structural, social levels must be addressed to achieve positive behaviors and health outcomes. To the right of the model, we've listed a few examples of the factors and interventions at the individual, interpersonal, community, and societal levels that were addressed in Hannah's paper. Without further ado, I'd like to present Dr. Hannah Koenker. The floor is yours.
Hey, thanks, Mike, and good morning, good afternoon, good evening, everybody. It's great to be with you today to talk about this paper. So I just want to begin with a brief description of what we set out to do. And if you're following along in the discussion guide, this is where we discuss the situation and the objectives of our analysis relevant to behavior change. So in terms of the study objectives, this study was conducted under the PMI Networks project in around 2012, 2013, 2014, and it was operations research. The goal of this study was to measure the impact of an SBC intervention on insecticide-treated net care and repair. So we wanted to see whether care and repair intervention to promote care and repair behaviors would have an outcome on the proportion of campaign ITNs that had observed repairs at the end of the study, as well as on the outcome of the proportion of net surviving and serviceable condition, which is measured with the proportionate whole index according to the WHO guidelines. In terms of the overview of the survey, of the study, this was conducted in the context of an LLIN campaign in Nasarawa State that was implemented in December 2010. The nets were distributed in December 2010. We then had 3 surveys in 2012, 2013, and 2014. And between those 3 surveys, we had 2 phases of social and behavior change interventions with results from the Midline survey informing the revision of the strategy to the SBC activities in the phase 2. So the activities for SBC were multi-channel interventions to promote ITN care, and you can see the timeline there at the bottom. We had developed a model loosely based on some of the other behavior change models that are floating around there, but trying to zero in on some of the attitudes, intentions, behaviors, and then outcomes that we had been observing through other research, particularly formative research done in Nigeria, but also Senegal, Mali, and elsewhere. And so there's a couple of papers from Nigeria and those countries out, in particular the one called "We Are Supposed to Take Care of It, a qualitative examination of care and repair behavior" for LLINs in Nasarawa State, that was led by Gabrielle Hunter. And so you can see here, perhaps in very tiny print, there's a lot going on in terms of being aware of what might constitute repair, social norms around whether people repair their nets or care for their nets, how that's done, habits around washing and tying up nets, intentions to adapt the net to fit their space better, intentions to avoid holes, intentions to repair holes, and then the actual behaviors of preventive behaviors, repair behaviors, etc. Then in the middle gray boxes, there's also the aspects, the physical aspects of the nets themselves in terms of textile strength, the knitting pattern, and then environmental factors outside of the sort of behavioral control of the household in terms of the number of children under 5, the type of bed that's being used, the sort of general state of the house, the presence of rodents, the temperature, etc. So all of these factors are thought to be important in determining what ultimately is net integrity, the physical integrity of the nets. And we were trying to tease out a little bit what might be important here through a number of durability monitoring studies within which this care and repair intervention study was nested. So in terms of the sampling for this study, we wanted to have a before and after intervention and control design. And so we identified two areas within Nasarawa State where we were going to place this study. So in Kokona local government area, we identified a radio station there that was reaching within sort of the boundaries of Kokona LGA, but not too much outside. And at the time we started the study, the radio station did not reach really all the way to Toto LGA down in the bottom left. So we selected that as the control LGA. And then we had baseline and midline surveys that were done with two-stage cluster sampling with 20 clusters, 15 households in each cluster per site and time point. Right, so then at the end line, the Koenker radio station, which was the Nasarawa broadcasting station or service, they boosted their signal about midway through our pilot intervention. And so the reach of that radio station extended into Toto at the end of by the end line survey. So to try and account for that, we increased the sample size at end line to 28 clusters with 15 households each. And there's some information about the sample size calculations there. The questionnaire that we used was largely based on the standard durability monitoring questionnaire used now across PMI countries and other countries. It has information about household characteristics, a net roster for nets received from the December 2010 distribution, information about the nets that were lost from the household since that campaign, what happened to them, net care and repair behavior and attitude questions, and then questions about exposure to care and repair messages and the physical assessment of existing campaign nets. All right, so now we'll turn to the methods. And if you're following along again with the discussion guide, the following slides will describe the components of the study design and the analysis approaches that we were aiming to take. So in terms of the analytical approach, we wanted to assess the impact of exposure to social and behavior change interventions on the outcomes. And we used a few different approaches that I'll go into shortly, but ultimately the multivariate logistic regression was performed to try and control for the background factors and potential predictors of exposure to assess the relative contributions of net care attitudes, exposure to net care messages on the outcomes of observed repairs on the nets, and then also the survival in serviceable condition. So we had just a few, let's see, Likert scale questions here in terms of the attitudes in order to measure the attitudes where people either strongly agree or strongly disagree. So 1 was strongly disagree and 4 was strongly agree. We calculated the overall attitude score basically by averaging those scores for the various questions. A wealth index was computed using principal component analysis. And then ITN condition was categorized in the standard manner by using the proportionate whole index and then assigning those into the threshold categories of good, serviceable, or too worn. And just a note that serviceable condition includes the good condition. Serviceable condition and that might have a few holes, but not so many or so large holes that mosquitoes would be able to enter easily. Next slide, please. So in terms of the intervention that was designed, this was done by our partner on the Networks project, CCP Nigeria. And they designed, along with staff on the project, a number of key messages and activities. So given that this was a multi-layer reinforcing SBC intervention campaign, we used advocacy approaches with community leaders, community interpersonal communication with community mobilizers who would go house to house or conduct sort of market days and talk to people about different net care and repair practices. There was a song contest in phase 1 for students and really anybody to create songs and submit them to the contest. There were some radio spots and some print materials. And the key messages were the sort of basic how to care for your net, how to repair it, reinforcing the messages from the campaign that nets are valuable and worth the time invested to take care of them properly. Focusing on the fact that torn nets can still be effective if they're repaired, and promoting the small doable action of repairing small holes quickly so that they don't become larger holes. Then in terms of the phase 2 intervention, this was refined a little bit with results from the Midline survey. And so the strategy was refined to move from sort of the initial exposure to these new messages around net care to promoting the sort of routine nature and habit forming of those net care behaviors. We adjusted the radio airtime plan to get more exposure via radio. We refocused the interpersonal communication activities on the aspects that had the most impact and the most reach. And so those were the house visits where we had more success in terms of reaching people. The song contest, I believe we created, we aired the winning songs on the radio and used that to promote net care behaviors, and capitalized on the gains that we had made with the community mobilizers and the community leaders. So in terms of the activities, we had about 260 airings of the radio spots, again, primarily within Kokona LGA. We had a 15-minute radio magazine program. There were 14 episodes of that. There were community dialogues and house visits that you see there. All right, so moving on to the results. If you're following along again with the discussion guide, the next slides describe the impact that we measured with the surveys of exposure to the campaign on the behavioral outcomes that we were interested in. All right, so this slide shows a couple things. Maybe I'll start with the graph first. So the graph shows the percentage of campaign nets that were found in, it says excellent condition, but this is good condition, so without really almost no holes at all. And from baseline at the beginning through to the midline in year 2 and then the end line in year 3, there was not really very much difference here in the proportion of nets that were in good condition. They fell essentially at the same rate. And we do expect nets to, fewer nets to be in good condition as time goes on because of the natural phenomena of how things wear out. And then the table just supports this as well. So down in the percentage of nets in good condition row down here, we had high levels of this at baseline, and then falling down to about 33% at end line in the control and the intervention zone, and then the p-value here just indicating that there was no reason to think that these were significantly different. This was the same for the proportion of nets that were in serviceable condition at end line, because serviceable condition is a slightly more lenient category of net condition, or a higher percentage of nets in serviceable condition than in good condition, about half by the end of the study. But again, no difference here in between the control and the intervention area. And then up at the top in the observed repairs, we had about 10% of nets with any observed repairs among nets that had any holes at baseline. And that grew slightly in the control and the intervention area, but no difference statistically there. Next slide, please. In terms of exposure to messages, at baseline, reassuringly, there was very little exposure to messages about care and repair because we hadn't put them out yet. And the dose there was largely 0. But by end line, we saw that a lot of the people in the intervention zone, around 73%, had some exposure to messages around care and repair. However, in the control area, almost 50% of the people surveyed had heard about messages related to care and repair. So we didn't have the sort of naive control zone to work with any longer. The radio station had boosted the signal, and there were some other activities ongoing that seemed to have spilled over into that control area. Next slide, please. So here we're looking at the results of the level of exposure to SBC activities broken out by channel. And so the blue bars are the control area. And so on the left, you can see that the control zone had reasonably high percentage, almost 30% of respondents reporting that they had heard something about care and repair on the radio, even though we hadn't intended for that to reach them. Slightly larger in the intervention zone, up to around 43%. And so in the intervention zone, the 2 largest channels of exposure were the radio and then from community health workers. In the control area, we had sort of the radio exposure, and then we had a number of health workers that may have been giving out the messages as well, perhaps because they had heard them on the radio. We don't really know. And then a few, 20% perhaps in the intervention zone exposed through the community events. And then a few other things. So not very much exposure through community leaders, very little exposure through faith leaders, a little bit of exposure through posters. We didn't send any posters to Toto, so I'm not sure what they were seeing there, but there's always some interesting tidbits in the data, even when you try to control an intervention. This is basically the same graph, but looking at more specific recall of different messages. So the most memorable message for the intervention area was this one about handling nets carefully. That was the one that people seem to recall the most. And likewise in the control area, that was also the message that they remembered most, although there is significant difference in prevalence there of exposure to that particular message. Using mild soap here in the middle and washing gently, those were also well remembered in the intervention area, along with tying up or folding up, which was also one of the more common messages remembered in the control area. These ones down at the end, sorry, if we could go back, with the quotes, these were some of the radio messages that we put out specifically to capture who might have heard those PSAs on the radio. So stitch in time saves your net. A net is like a broken shield, or a torn net is like a broken shield. It doesn't protect you. These are a few of sort of the catchphrases from those radio spots. All right, and then finally a similar graph, but this is for the reported care behaviors that the household says that they do at home. So a lot of households in the intervention area reporting that they try to keep their nets away from children. They try to wash them gently. They try to roll them up or tie them up when they're not in use. They wash them only when dirty. And to a lesser degree, but still, those are the same major messages or the same major behaviors that the households in the control zone were reporting. All right, so then we wanted to see whether exposure to messages from the campaign was correlated with positive attitudes. So on the y-axis we have the mean attitude score, which was on a scale of -2 to 2 after we recoded it. And so a very positive attitude is anywhere from 1 and up, and a reasonably positive attitude is between 0 and 1. And along the x-axis, we have the number of sources of information cited. So these are the different channels, so radio or IPC, community health worker, et cetera. So we see that as the number of channels people reported being exposed to rose, there was a higher average attitude score. So there's some dose response relationship going on here, potentially with the number of sources of information that were received, and then a correlation with the positive attitude. So these were linearly correlated with a regression coefficient of 0.13 and a p-value of less than 0.001. Then we wanted to see, is positive attitude correlated with our outcome variables of serviceable condition and the presence of repairs. So again, along the y-axis, we have, this is the percentage of confirmed campaign nets, of the campaign nets, that in the sort of first group, the proportion in serviceable condition, and the second group, the proportion of nets that had observed repairs. And then the red bar are households where the net care and repair attitude was negative. And then the light green bar is a positive attitude, and then the dark green bar is a very positive attitude. So those with more positive attitudes did have higher prevalence of observed repairs, as well as proportion of nets in serviceable condition. And then ultimately, we wanted to try and assess whether there was a difference in the median lifespan that could be associated with positive attitudes towards care and repair. And so this graph shows the decay curves for nets as they start out in good condition. The proportions that then survive in serviceable condition declines over time. And as you can see, that maybe the red line here indicates a 2-year median lifespan. The green line is a 3-year median lifespan. This purple line is a 4-year median lifespan. So for households that had a positive care and repair attitude, their median lifespan was almost a year greater than households that had a negative care and repair attitude. So we can see that the negative care and repair attitude is sort of more along this red line, the 2-year line, and the positive attitude is more along the green line. And this gives us the difference in terms of the median lifespan. And there's a lot more on this in the journal article that you can also read. So essentially the median lifespan difference was about a year for households where they had positive attitudes. And in terms of exposure to the campaign, we calculated that exposure to the campaign was associated with approximately a 9-month longer estimated lifespan for nets in those households. This is the multivariate regression for the nets in serviceable condition, looking at the background factors. We had a strong correlation in terms of the positive attitudes here with an odds ratio of 6.7, more likely to be in serviceable condition. And then again, having a higher dose of having recalled more channels, so 3 or more sources as compared to no sources, was also associated with more campaign nets being in serviceable condition. The number of children under 5 was negatively associated with serviceable condition. This has been borne out in some of the other studies. The more kids under 5 you have, the more destruction occurs with your nets. Unless you're quite careful about tying those up and keeping them out of the kids' hands. And I think anybody with kids or kids in their lives can attest to this, the destructive power. Nets that had any observed repair were less likely to be in serviceable condition, and we'll talk about that in a moment. And then the net being tied up also contributed positively to survival in serviceable condition. Next slide. So we also wanted to look at which channel might have worked better or worse to try and inform decisions about how to refine these interventions in the future. So we regressed serviceable condition on the types of exposure, and we looked at radio exposure only, interpersonal communication exposure only, and then the combination for people who had been exposed to both radio and interpersonal communication. Now, everybody who had been exposed had higher odds of having their nets be in serviceable condition at the end compared to people who hadn't been exposed to the campaign at all. But radio exposure only was actually the best performer there. So it's possible, and as we said in the paper, that communicating net care and repair messages via radio alone without resorting to interpersonal communication, which can be effective but is also more intensive and expensive, radio communications may be sufficient to prompt people to conduct these basic care, net care behaviors in terms of preventing holes from forming. However, the dose-response associations from earlier in the presentation also support the basic tenets of SBC, that when we do have multiple channels that have reinforcing messages, this is more effective than simply relying on a single channel. So the programming implications, we want to ask what does this all mean, and how does that help us adjust our programs to gain more advances against malaria. So the next slides will explore programmatic implications and generalizability. So in terms of the programmatic implications, the number of channels through which respondents were exposed and their attitudes about ITN care were predictive of nets being in serviceable condition at the end of the study. So the implication is that, as we've learned from many other SBC interventions, multi-channel SBC is more effective than use of a single channel, although in this particular case, radio alone also performed well. We also learned that SBC interventions, or these specific SBC interventions, extended the median lifespan of ITNs by approximately 9 months for households that were exposed to the campaign. So it's possible that SBC can extend net lifespan by promoting net care behaviors that prevent the development of holes, and that this helps households hang on to their nets for longer in better condition, and thus can maintain higher levels of ITN access between campaigns or for longer periods. In terms of generalizability, as I mentioned before, we had done formative research in a number of settings: Senegal, Mali, Nigeria, and Uganda. And the findings across these different formative research studies indicated that the attitudes around net care and repair were pretty similar from place to place prior to any social and behavior change interventions being done. So given that the attitudes around net care and repair were similar across different settings, it's reasonable to suspect that an SBC intervention to promote net care might have a similar impact in those settings, although further research would be needed to confirm that. The strengths of this study were that it was an intervention and controlled design with a before and after intervention assessment. We had the randomization and the two-stage cluster sampling, which limited selection bias. The control and the intervention communities were demographically, socioeconomically, and environmentally and culturally similar. I didn't show that data, but it is in the paper, which increases the likelihood that we do have a meaningful comparison and reduces bias due to allocation. We also tried to mitigate response bias by comparing self-reported data on net repair with observed net condition and observed repair. So the outcome measure that we used was not whether the household said that they had repaired nets, it was whether the data collectors observed repairs in the nets themselves. The limitations, we did have the issue of the leakage or contamination of the intervention into the control area, the control LGA, by the boosting of the signal of the radio tower in Kokona. And it's possible that repairs were maybe overlooked during some observations by the data collectors. We do have in the data some indication that response bias was present for self-reported repairs. So people were reporting that they did more repairs than we actually observed. And this was particularly in the intervention LGA, and that was why we did only include observed repairs and the physical net condition as the outcome indicators for the study. So ultimately, net repair did not improve net condition. So repairs were done too late. Once the net was already rather torn, they were not sufficient. With nets that were quite torn, the households were really only repairing a few of the largest holes, but not the rest. And so there was no impact of net repair on net condition at the end of the study. And this has been borne out in additional research and durability monitoring conducted over the last 5 years. ITNs that were tied up during the day were far more likely to be in serviceable condition compared to the repaired ITNs. And so this is one of the reasons why we've tried to focus SBC key messages on net care practices, tying up, treating them carefully, washing them carefully, drying them inside, not on thorny bushes, etc. And we haven't tried to promote net repair as a way to make nets last longer. So prevention is better than repair in this case as well. The frequency of washing and drying practices were not found to be significant predictors of net condition. And it may be that in the setting, those practices were not as damaging as we had anticipated. This is definitely something that we do monitor in the ongoing durability monitoring to determine where these practices might be detrimental and where they might be just not as destructive to the nets as we thought. Next slide. All right, and then linking up with the current research. So a lot more durability monitoring has been done over the past 5 or 6 years. And this has largely demonstrated that median net lifespan varies across settings much more than it varies across brands. I think everybody's familiar with instances where specific brands are having some manufacturing problems. But for the most part, we are finding that a brand might perform quite differently in different settings across different countries, and that the setting makes more of a difference in the net lifespan than the product itself. We're also finding that while in many cases nets are wearing out physically before they lose bioefficacy, there are some cases where the bioefficacy is not very good quite early on, and that's a cause for investigation, obviously. Durability monitoring in terms of both the physical integrity and the insecticidal bioefficacy does allow national malaria programs to track net cohorts and identify problems that might be arising either from poor net care behaviors, which are changeable, as we've seen, through social and behavior change interventions, but also through manufacturing or storage problems where those may be arising. So those are some of the links that the Net Care and Repair study from 2014 has with some of the current research that is being published now. Thanks very much, and I'll turn it back over to Mike, I think, to facilitate the discussion.
Thank you so much, Hannah. Before we break into the different questions, I would like to turn it over to Shelby from PMI for just a quick note.
Thank you, Mike. And Hannah, thank you so much for an excellent presentation. And so before we open the floor for discussion, I just wanted to take this time to emphasize a key point that Hannah discussed on the slide with programmatic implications. And that is that findings from this study presented today and other PMI-funded operational research has helped us to understand the various behavioral factors such as knowledge, attitudes, practices that motivate or impede net care behaviors. And based on these findings, PMI does not support ITN repair activities, for example, distribution of ITN repair kits and social mobilization promoting ITN repair efforts. PMI does, however, strongly support SBC activities that are focused on comprehensive ITN care and consistent use, with a primary emphasis on promoting preventive behaviors the net from damage, as this complements the behaviors that must be across the net life cycle to improve overall ITN durability. Thanks, Mike. And so at this time, we'll open for discussion. There were a number of folks who did provide questions throughout the presentation, and we encourage you to please continue to type your questions in the chat box, and we'll start trying to get these answered in the order that we received them. The first one that we received came from Dawn. Dawn, would you like to unmute to ask your question related to the exposure correlated with the positive attitudes?
Sure. Thanks, Shelby, and thanks, Hannah, for the excellent presentation. It was really interesting. I noticed in one of your first graphs that on net survivability or nets that were in good or serviceable condition at the end of the intervention, there was no difference or very little difference between the intervention and control area. And then later you showed some graphs where you showed that there were less care behaviors practiced in the control zone, yet that resulted in no difference in the net survivability. And then you said that your study started out as a control intervention study, and then it looks like all of the presentations or all of the results were more of an end line baseline, and you pulled all of the respondents. I seem to remember that from the paper. Could you address that, and did that have any impact on the analysis? Over.
Yeah, thanks, Don. And my apologies. I don't think I made it clear that we did shift the analysis from the original or intention to treat focus in terms of control and intervention. Once we did find that the exposure in the control zone was almost 50%, we presented those results, I think, in the paper, but then the main analysis switched over to being an exposed, non-exposed, pooled analysis between the two LGAs. So yes, the remainder of the slides that I showed in terms of the results and the outcomes and the multivariate regression was based on, number of messages or number of channels people had been exposed to, whether or not they were in the intervention or control LGA, although we did include a term for the LGA in the final model. And it was about, I think the odds were reduced by about half for the control LGA in terms of net median lifespan or years of serviceable condition. So there was an overall impact of being in the control zone, which lowered the percentage of nets that were in serviceable condition once you controlled for all of those other factors, but it doesn't show up in that graph of the nets in good condition that I showed at the start.
Thank you so much, Anna. So we've got another question here, and it's about the Likert scale that was used. The question is, the Likert scale was used from 1 to 4, strongly disagree to strongly agree. What was the score given to the neutral undecided responses?
Yeah, thanks for this question. So in this particular survey and for the standard durability monitoring, we did not allow a neutral response or an undecided response to those questions. And people can debate the merits of that, but I think in our situation, we wanted to make sure that we had data on either side of that argument. And actually, the responses for the most part were quite heavy towards the positive attitude side. The median was definitely not in the middle. And that was just a decision that we made from the onset, and that's been maintained through the rest of the durability monitoring surveys, that we just have a 4-point scale for those questions.
Thanks so much. We have another question here from Ali Ujala, and he's asking, in the study, did we ask who was most likely to repair nets in a household?
Yeah, I believe we did. I am not sure we reported it explicitly in the paper. We did include a term in the regression for whether the spouse or the head of the household was the respondent, and female-headed household or female respondents were more likely to have nets in serviceable condition at the end, controlling for everything else. In the formative research, and Gabrielle might need to back me up here, my memory is that when we asked people who was most likely to repair nets, men and women sort of both said that they themselves were more likely to repair. So there was some disagreement about who was ultimately responsible, and some of that I think was due to some gender norms around the men thinking, well, I'm the head of the household, therefore if my wife is repairing it, it's really because of me, because I'm directing her to do it. But I think there's more information on that in all the formative research, and there was a recent paper in the last year or two from Tanzania that explored more in much more detail, a very nice paper out of Ifakara Health Institute about the gender aspects of net care and repair. So I would direct folks to look for that from Tanzania.
Great, thank you. We've got another question from Zila in Niger. She's asking if there is a way to superimpose malaria incidence with the proportion of nets in serviceable condition.
Thanks, Zila, for that question. No, in this study we did not correlate malaria incidence with anything. There's some work going on that I'm aware of, I believe Malawi, DRC, researchers have tried to look at correlating malaria incidence with the overall sort of condition of the net crop in country at a given moment. But that's not something that we were able to do as part of this operations research.
Right, and it looks like we've got two people, both Kendon Hoffman and Echiende, asking about the channels. And it looks like both questions sort of get at when you look at the different channels and see which was sort of carry the most weight. It looks like radio was particularly interesting. Echiende said that community health workers, faith leaders, they also tend to be really important. Do you have any idea as to why do you think in this particular case radio had such agency?
So I would say we had a lot of focus on the radio activities because we had the NBS radio station to work with. I think you saw that we had 14 instances of the 15-minute radio magazine, we had the song contest, we had the jingles. We did push a lot of messaging through the radio. So the results that we're getting from the IPC, I think, were good, but the radio was reaching just numerically a higher number of people.
Thanks. We got another question here from Greg Pirio. He's mentioning that since the study was conducted, the growth of social media and SMS have been great. And I believe he's referencing the Night Watch study that was done in Cameroon as an example of a way that can be particularly useful. Do you think there's a potential to include these newer media channels, particularly for increasing the longevity of ITNs?
Yeah, I think the Cameroon study has a couple analytical problems or analysis problems, methodological problems that we may want to look at, but in terms of fully controlling for access to nets. But I think obviously SMS and social media are very powerful, as we're seeing in a variety of settings, particularly over the last several years. There is, of course, enormous potential for these to help increase net care behaviors. We did not use those in this particular study, just because of, I think it was almost 8 years ago or 9 years ago that we started it. So things were not quite as prevalent then. And we were focusing on radio. So yes, I think the channels that we need to use are the ones that are reaching people and that are resonating with people. And as people's consumption of information changes and the ways that they consume information changes, we want to make sure that the messages that we're putting out, particularly in a multi-level reinforcing campaign, are taking advantage of the channels that people are most using. That's something that, SBC practitioners have been doing for years, trying to figure out, where to place the ad right before or after the most popular, TV program, before SMS was even a thing. So we use the ways to get to people that are going to be most effective. And I think SMS and social media are ways to do that.
So continuing in that vein, Abisoye has a question, and he's noting that it looks as though radio alone had a higher odds ratio than radio combined with IPC. Sort of normally expect a synergistic effect there. Is there anything there, any detail that might explain that?
I'm sorry, can you repeat the question?
He's saying, can you please explain how radio alone had a higher odds ratio than radio plus IPC?
Yeah, so I think the finding here is that there were potentially a lot more respondents that did have a radio-only exposure, and that there were, in terms of the nets that were found within their households, ultimately those nets in those households that reported only a radio exposure had a higher odds of being in serviceable condition. So to a certain degree, it depends on the relative sizes of those categories. And it's possible that we had quite a number of, just in terms of the respondents, that we can observe that phenomenon where we had higher odds of being in serviceable condition among the population that had only been exposed through radio. I agree that we would maybe expect people who had gotten both radio and IPC, or reported both radio and IPC, to have strong protective effect, but in this case, it didn't show up in the data.
Thank you. So we've got a question here from Rose, and she's asking if we could speak a little bit about how these results might apply in a global and local context, as there's much higher access to ITNs and generally higher exposure to ITN SBC than existed at the time of this study.
Yeah, this is a great question. So I think it's true. There's at the time that we did this, the study populations were not much net care and repair SBC had been done at that time. And so as we go forward, just as we have with sort of net use messaging, there becomes maybe a ceiling effect or threshold effect where we can do a certain amount of messaging to make people aware of the need to tie their nets up or treat them carefully or try and make them last longer. But after some time, those messages aren't going to be new anymore, and the behaviors hopefully will be ingrained, and there's going to be less room to move on those behaviors. But that would be a great place to be, actually, if people are kind of systematically tying their nets up and trying to take care of them the best they can. You know, there's always going to be things that happen to nets in a household, and you know, we can't prevent all net deterioration or net wear and tear. But I think we should expect, as we go on, to see some reduction in improved behaviors as a result of messaging, simply because people are getting more exposed and more used to those messages.
All right. Thank you. We've got a question here as well, not in the chat box, but recognizing the SBC campaign began in around 2012, 2 years after that, the nets were initially distributed. What does this tell us about the timing of the SBC activities to promote ITN care? Was it an ideal time to emphasize the uptake of care behaviors within the ITN lifecycle and to further improve durability?
Yeah, I think so. I think initially we had intended to begin the study in the phase 1 intervention a little bit earlier than ultimately happened. And of course, with delays and approvals in IRB and sort of the usual thing that timeline shifted a little bit. So I would say for sure in the first year after a campaign is a great time to be beginning that net care SBC if you're trying to time it. And we have an SBC toolkit for ITNs that really delineates this and maps this out in terms of the timing of when you might want to emphasize certain messages around nets in the cycle, in the campaign cycle, the 3-year campaign cycle. So I would say, you know, to answer your question, no, it maybe wasn't ideal to start the intervention 2 years after the distribution. We would have liked to have started it sooner. But at the same time, there were a lot of gains that were observed in net serviceability as a result of the intervention, and hopefully that's still an indication that better late than never. But if programs have the opportunity to start that messaging earlier, to have it kind of continuously coming in, maybe at a certain time of year or a certain period of the campaign, to help prompt those care behaviors and make them habits, that may go a long way.
Thanks so much. Another question we have here is there's some literature suggesting that mosquitoes are more likely to enter holes in specific locations, for example, on the top of the net. The PHI doesn't consider the location of the holes, but is there any data on the location of net damage potentially influencing repair behaviors? Could this be considered in SBC messaging?
Yeah, I think, you know, there's good data to indicate that mosquitoes are attacking the top of the roof. On top of the roof of the net more than they're attacking the sides. This is one of the reasons why net manufacturers are putting new active ingredients on the roofs of nets, but not always on the sides, because there's more contact with the mosquitoes up there. So yes, I think the PHI doesn't currently take into account where the damage is located. I think there was a paper in the last few years proposing an alternate weighting to account for the fact that mosquitoes do attack the roof more, and damage to the roof is going to be, in that sense, more important than damage to the sides. Damage at the very bottom may be kind of irrelevant because people tend to tuck their nets in, and so those holes may end up being sort of hidden. So I think there's sorry, Mike, I'm forgetting the second half of the question and I'm not finding it in our tracker. But
so we've got, it says PHI doesn't consider location of the holes, but are there any data related to the location, and how could this be considered as far as SBC messaging goes?
Yeah, so for SBC messaging, I don't know that we need to make it too detailed for the majority of people. I think in emphasizing that the nets should remain intact as a general principle is probably sufficient, and the time that it would require to explain that maybe the roof is more important, they should repair the roof first, because the mosquitoes are up there first, you know, it maybe gets too much into the weeds from my point of view. But certainly, you know, if people are interested in talking about that at a community dialogue or something else, you know, there's scope for that there.
Okay. We've got another great question here too. Would the next step in the analysis be to look at whether or not a net care behavior led to an increase or decrease in the net use?
So in this study, I don't think we even really reported on net use except in passing. There may be some association with you know, emphasizing net care behaviors that might also help to improve net use. I think there's a lot of other factors that go on, that go into the reasons why people aren't using nets on a particular night or a particular season. And yeah, I mean, I don't know that we've run anything on the data that we do have to assess net use behaviors as a result of the net care messaging. But that's something that could be explored in other contexts, or certainly we would expect that it might have a reinforcing effect on net use.
Great. I want to give Shelby a chance to ask any questions that we've tracked here. Is there anything else that you want to focus on in the last few minutes that we have?
Thanks, Mike. Another question that we had prior to today was, Hannah, if you could speak a little bit about any implications of the findings of the pooled durability monitoring analysis that physical damage to nets is important, not only because of its immediate effects on transmission, but because physical damage is a major reason for nets falling out of use and being discarded.
Yeah, so yes, there's a pooled analysis paper that has just been accepted at Malaria Journal, where data from 8 of the early PMI durability studies done by CDC and various national malaria control programs and research institutions, that data was merged and pooled and looked at in terms of the open malaria model by researchers at Swiss TPH in Switzerland. So the results of that have been reported over the past couple of years at Vector Control Working Group. And as Shelby said, the upshot is that the holes in the nets that form are the major contributor to why people are discarding them and not using them. So as the holes form, people either stop using them and turn to new nets, which they may have, but which weren't sort of controlled for or monitored in those studies. But they stop using those nets, and that is a key driver of transmission in the model that was built around these data, and that's explained in the paper. So I think intuitively, it may make sense to a lot of us that when we have nets in the household, they start wearing out, we stop using them. And this is really the major driver of attrition, of the loss of ITN access over time. And the extent to which those nets are being replaced or not in a timely fashion is a major driver of sort of being able to maintain access to nets. So I think that paper, when it comes out, will be really interesting to discuss in more detail with the lead researchers for that. But yes, you know, it's less the bioefficacy on a sort of large scale basis that is driving the loss of these nets or the reduced efficacy of these nets. It's the loss of the net, I guess the retirement of the nets due to their net condition that the household is you know, discarding because they're worn out.
Thanks so much, Hannah. We want to be respectful of people's time. We are at 10 o'clock here in Eastern time. But just before everybody leaves and we wrap up, I want to remind everyone about the resources we mentioned earlier. The Malaria SBC evidence database is searchable by country, intervention, audience, and study design. Next slide. And it also contains infographics, as you can see here. You can use these for your own advocacy within your program or among other partners. There are graphics that show the impact of ITN, service provider, and malaria case management, SBC. the impacts that these interventions have made. There are also fact sheets that summarize the key findings from over 3,600 peer-reviewed articles, 1,700 gray literature articles. The fact sheets are presented in 3 malaria technical areas: ITNs, case management, and service providers. Finally, I'd like to thank Dr. Hannah Koenker so much for joining us today. Thank you all for these great questions. Please stick around for a couple of questions when we close.